Understanding Burnout in Healthcare. Module 1. Hello, and welcome to Module 1 of our Combating Burnout course. In this session, we'll talk about what burnout is, why it matters, and how to recognize the early signs in yourself and others. In this module, we will cover: what is burnout? Definition. Why healthcare workers are at risk. Common symptoms, emotional and physical. Quick self-check exercise. Impact on work and life. Key takeaway points. What is burnout? Burnout is not just being tired. The World Health Organization defines burnout as a work-related syndrome that involves three main features: emotional exhaustion, depersonalization, or feeling detached from your patients or colleagues, and a reduced sense of personal accomplishment. Why healthcare workers are at risk. Healthcare is one of the most demanding professions in the world. Long shifts, heavy workloads, constant emotional intensity, and the responsibility for human lives make us especially vulnerable. Burnout is not a personal weakness. It's often a predictable response to the pressures of the healthcare environment. Common symptoms. Burnout can show up in different ways. Some common signs include feeling drained even after rest, difficulty concentrating, becoming cynical or detached from patients, increased mistakes at work, or feeling like the work you do doesn't matter. It's important to note that symptoms can be physical, emotional, or behavioral. Let's do a quick self-check. Ask yourself, do I feel emotionally exhausted most of the time? Have I become more irritable or withdrawn? Do I feel like I'm just going through the motions at work? If you answered yes to more than one of these, it may be time to pay closer attention to your well-being. Feel free to pause the video and reflect for a moment. The impact of burnout. Burnout affects more than just you. It can harm patient care, lead to higher medical errors, increase staff turnover, and strain relationships outside of work. But here's the good news. Burnout is preventable and manageable once we recognize it. Key takeaways. Let's recap the key points from this module. Burnout is a serious work-related condition, not a personal flaw. Healthcare workers are especially at risk. Recognizing early signs is the first step toward recovery. What's next? In the next module, we'll look at practical strategies to manage stress and protect your emotional well-being during busy shifts. Before moving on, download the worksheet for this module and take a few minutes to reflect on your own signs of stress. And don't forget to join the community discussion where others are sharing their experiences. Thank you for completing this module. Let's continue this journey together.